Delegates, leaders, colleagues, and distinguished guests, serving as your 161st ADA president has been the honor of a lifetime. And to close my term here in Washington, D.C. feels surreal. We're gathered here at a time when our leadership in dentistry has never mattered more. And for me, this city is where my own national leadership journey began. 27 years ago today, not today, sorry, a few days ago, I was at the rock bottom in my addiction. I didn't know if I wanted to live, let alone be a dentist. But through the gift of grace, I chose sobriety. And it was this community, through the resources and support of the tripartite, that set me on a path to recovery. From that moment on, I was inspired to live my best life and help others do the same. I began volunteering at a treatment center in Denver, offering free care to people in recovery from substance abuse. But I couldn't do it alone, so I called my local component, Metro Denver Dental Society, for help, and the rest is history. That opened doors to leadership in organized dentistry I never expected, including the day I found myself right here on Capitol Hill, where the ADA asked me to testify before Congress in support of a bill expanding dental care funding for individuals struggling with addiction. I told lawmakers what I had experienced firsthand and how dentistry changes lives, how a new set of dentures or even one repaired tooth can open doors to employment, education, the ability to chew and nourish the body, and the strength to remain in recovery. My life, from rock bottom to standing before the U.S. Congress, it still feels impossible. It still feels like a fairy tale. And now, to return here to close out my presidency brings it all full circle. Every time I'm in this city, I take a run to the Lincoln Memorial to watch the sunrise over the Washington Monument. And some of you joined me this week. I always take some time to reflect on the power of Dr. Martin Luther King Jr.'s I Have a Dream speech delivered from that very spot in 1963. Every visit recharges me and inspires me. It inspires me to be courageous, to stand for what I believe in, and to live my why, which is to be a catalyst for positive change in this world. This year, I needed that reminder time and time again. It was a year of constant challenges, which forced me to grow. I was humbled, stretched, and inspired in ways I never could have predicted. Together, the ADA navigated a new presidential administration and a volatile healthcare landscape that questioned scientific truth. We navigated rapid change within our own association. We faced leadership transitions. We faced tough, unprecedented challenges, and we had to take decisive action. There were several moments when we stood at a crossroads where we had to face our own shortcomings and then reset. And as your ADA president, I garnered both support and scrutiny from my peers. But as the saying goes, the best sailors don't earn their reputation by staying in port. They earn it by weathering the storm and pressing forward. And into the storm we went. I didn't run for this position to manage the day-to-day business operations of the ADA. I ran for office to drive this profession of dentistry forward. But when we saw that the business operations were not heading in a good direction, we course-corrected 3 months into my term. Being a change maker is hard because change is hard. And I've learned over the last several years that everybody wants change, but very few want to change. And that's because it challenges our comfort zone and it disrupts our norm. But as leaders, we have an obligation to hold firm to our mission, vision, and values, and to make this profession the very best it can be, not just for today, but for tomorrow too. And as president, I set out to align all of our actions along this line. So that brings me back to earlier this year when I visited Cologne, Germany for the International Dental Show. My hotel was right across from the Cologne Cathedral. This building nearly took my breath away, not just for its beauty, but for what it represents. You see, it took more than 600 years to complete. Across centuries, generation after generation of builders stayed faithful to that architect's vision. How did this happen? How did they stay true to this vision 600 years later? To me, this is the story and the challenge of the American Dental Association. As we approach our second century, dentist by dentist, year after year, we've been laying stones. Like those builders, we too are mounting a vision bigger than ourselves. A vision that transcends me, the Board of Trustees, and this House of Delegates. At our very first board meeting this year, I asked our trustees to read aloud the ADA's mission, vision, and core values. And if you'd bear with me, I'd like all of us to do this together right here and right now. Because in my 20 years as a member of this House, I cannot recall a time when these were articulated. So please humor me by reading them aloud together. Our vision: empowering the dental profession to achieve optimal health for all. Our mission: to help dentists succeed and support the advancement of the health of the public. Our core values: commitment to members, integrity, excellence, commitment to the improvement of oral health, evidence-based, diversity, and inclusivity. These are our guideposts. Without them, we stand for nothing. And if we stand for nothing, we'll fall for anything. At that first meeting, I also asked our trustees to reflect on their own personal values and how they align with the core values of the ADA. And I'd like everyone in this room to consider the same, because that's why people become members and why they stay members. They see themselves in the values we stand for. Stephen Covey said courage is the most important core value because it compels us to act upon all of the others. Courage is the bold catalyst of change, and I learned that lesson in my recovery, as a dentist, in my leadership, and as an athlete. Last year I spoke about my first Ironman. Treading water at the start line, projecting out 140.6 miles ahead of me, swimming, biking, and running a marathon. It felt impossible. But you don't finish an Ironman all at once. You finish it 1 mile at a time. That's what leadership is about, one courageous step at a time. And this year demanded many courageous steps. Steps that carried us into the halls of power right here in DC to fight for what's best for our profession and the communities we serve. Just before the presidential inauguration, I published an editorial in the Washington Post asking the incoming administration to ensure dentistry's place within national health policy. I followed it up soon after with a letter to President Trump and every single member of Congress sworn in that week. We stood up and we said, hey, we are the American Dental Association. This is who we are, and this is what we stand for, and this is how America will get healthier, starting with oral health. By May, our leadership team was invited to the White House to meet with Dr. Heidi Overton, Deputy Assistant to the President for Domestic Policy and the principal author of the Make America Healthy report. We understood the importance of community water fluoridation, infection control, public oral health infrastructure, and NIH research funding. We fought to protect the mission of the CDC Division of Oral Health. Our message was clear: oral health is health. And that was the first pillar of my presidency, of reconnecting the mouth to the body. And I carried that message out everywhere, in roundtable discussions, national media interviews, and in editorials like the one in the Journal of the American Medical Association Health Forum, where I highlighted the concerning costs of eliminating community water fluoridation. we will see 25 million more children with caries at a cost of nearly $10 billion in added treatment within 5 years. The science is clear: remove fluoridation and people will suffer, especially our children. At times, it felt like my presidency was to be defined by this fight. And as a dentist and a dad of 4, I knew this fight was worth it. We had to stand up for science, one of our core values, and we courageously backed up those words with action. Our advocacy team launched a national media campaign and a grassroots campaign. We armed state and local associations with tools to fight misinformation that helped kill 31 anti-fluoridation bills in 16 states. I had the privilege of testifying before the FDA to keep fluoride supplements available for families without fluoridated water, because there's a bigger picture: protecting children, families, and communities. That's what we do. We make people healthy, which is why we cannot continue to accept being treated as an afterthought in healthcare. We know and we've proven that oral health is essential to overall health. And when over half of our nation is excluded from care, this system is failing. But here's the good news: we're making progress. Just days ago, for the first time ever, I shared the stage with presidents of the American Medical Association and the American Nursing Association at the health conference. Leaders of medicine, nursing, and dentistry. 3 leaders uniting to confront shared challenges like burnout, workforce shortage, and access to care. Earlier this summer at Dentistry's Role in Complete Health Symposium, we brought dentists, researchers, physicians, and public health experts together to advance the oral systemic connection. And in September, ADA leadership joined FDI, the World Dental Congress, as they announced their intention to create a global study of effectiveness and safety of fluoride, inspired in part by our leadership last year. That same month, I joined global leaders in New York City during the United Nations General Assembly for a high-level roundtable on the rationale for investing in oral health. This year, the ADA has elevated the conversation around oral health to the level of the President of the United States, to the United Nations, and on the global stage. We proved that our ADA is one of the biggest drivers of our profession. The world is watching, and they're joining in. This year, we stood tall in our science, in our innovation, and in our advocacy. At the ADA Forsyth Institute, our scientists are breaking new ground in tissue regeneration, artificial intelligence, and salivary testing that one day could help prevent diseases like Alzheimer's or diabetes. With the University of Pennsylvania School of Dental Medicine, we launched the ADA's Living Guideline Program, the very first in dentistry. This ensures clinical practice keeps pace with evidence in real time. And in advocacy, yeah, let's talk, that's big. And in advocacy, we took bold, decisive steps forward. Take a look at the slide. It shows just a few of the wins we achieved last year. From pushing back on tariffs that would have raised costs for dentists and patients, to securing favorable tax policy, to advancing major insurance reforms across the country. Because this is what it means to play the long game. It's vision turned into action, and action then turns into impact. We also pressed for real Medicare Advantage reform. Millions of seniors now look to MA plans for dental coverage, but too often these plans fail patients and burden providers. It's time to create a system that is comprehensive, transparent, and removes the administrative burden that discourages dentists from serving this population. And no matter what benefit plan we participate in, be it private or public, dentists must be paid the full fee for the care we provide. I've said it before and I'll say it again. Why is it culturally accepted that a rod of titanium in the hip is essential, but not here in the jaw? Why is walking any more or less important than chewing, removing active infection, or having a smile where one can face the world with dignity? It's time to demand bold changes, to refuse a broken system and create one that works, one that puts patients first and recognizes the mouth as part of the body. The result, millions of people will have a dental home. And so to all of our government officials, please take note. This is how you make America healthy. You start with the mouth. My second pillar was wellness. Last year I spoke about the toll of mental health challenges and the rise of suicide in our profession. And I said then, and I'll say it again now, we cannot allow one more life to be lost. Just recently I heard of 2 dental students who took their lives. And I continue to hear of our colleagues who have taken their lives. It breaks my heart because I know how heavy those burdens can feel. But I also stand here as proof of the power of this profession to save lives. Because resources were there when I needed them the most. I was given a second chance. We need to continue to ensure that others have the same support. This year we changed the narrative and culture around clinician wellness. We elevated our wellness resources to members, dental teams, and students at no cost. We worked to change licensing and credentialing so individuals in recovery or those who have suffered other mental or physical health challenges don't face unfair barriers. Several states have already shifted from punitive to supportive approaches, and I really want to thank those states because I'm seeing a shift. We're having more conversations around wellness, and I'm seeing more colleagues supporting each other. The stigma is beginning to lift. I always say we are our most valuable assets, and we must take care of ourselves as such. There's still a lot more work to do, and I know our incoming president, Dr. Rich Rosado, will carry this momentum forward. And that brings me to my third pillar, respect and belonging. I do not care how you practice, what you look like, your gender, your age, or your sexual orientation. Every single dentist deserves to be respected, supported, and heard by their association because every voice has value and because our future depends upon it. Unfortunately, this year required some tough fiscal adjustments and hard decisions. Some adjustments affected programs that mean a great deal to many of us, myself included. I'm here to tell you that our core values of diversity and inclusivity remain, and we will find ways to keep this work moving forward, especially under Dr. Rosado's leadership. He'll expect from each of you a relentless creativity in how the ADA continues to live its values, and the generation of members will rightfully hold us accountable. For the last 15 years, growing membership has been our greatest challenge. Not from a lack of effort, but because the world is changing much faster than we are as an organization. With that, so are the needs and expectations of current and future members. And they all demand and deserve meaningful value from their ADA. We can't keep doing the same thing and expecting different results. We must reinvent not just what we offer, but how we represent our members and address their concerns. Our business structures need to evolve, and our governance is holding us back. And that's why the Board of Trustees is proposing a 2026 governance study. Think about it. If we were to create the ADA today, would we design it with the same governance structure we have now? Our current governance structure worked really well in the 90s, but it's not working today. And it definitely is not going to carry us towards a preferred future. We need to stop defending the past so we can focus on creating the best possible future. Over the years, we started laying groundwork. We invested in new tools and systems to help us modernize and grow. And we did so with the best of intentions. The intentions were to strengthen our membership, to grow non-dues revenue, and redefine our value proposition. But those choices came with technology challenges and financial strain. As soon as we recognized the challenges with the AMS transition, your board of trustees made bold decisions to stabilize us and put us on a better path. Remember, I asked them to act with courage at that first meeting, and so they did. Who knew that courage would be tested under such choppy waters? We held open discussions, we listened in real time, and we made it our top priority to make things right for the tripartite. But ultimately, we knew the best way to navigate through this storm was with transparency and trust. At times this year wasn't easy, but through it all I was reminded how much this role in our ADA matters. Not just here at home, but around the world. I hit the road to listen to our members and share our vision of the future. I cherished every single conversation. I visited more than 30 dental schools, students excited to find their place and create their vision for the future, many of whom I now mentor. I met new dentists fired up to lead and seasoned colleagues who've carried this profession for decades. I united with leaders from around the world, so many of them eager to share their challenges and hopes. At one global retreat, as I entered the room, leaders from every continent swarmed me to shake my hand, not just because it's me, but because we are not just any dental association. We are the American Dental Association. When I walk the halls of our new headquarters, I see that legacy. My own words, "We are the change makers," are now etched upon its walls. And just down the hall is G.V. Black, who once stood where I stand now as ADA president in 1900. After I saw his picture displayed, I realized that the ADA's legacy is bigger than any one of us. And while we honor the shoulders we stand on, we must keep looking forward and harnessing the power of now. Because now is when the courage of this House of Delegates will matter most. The choices you make this week will lay the stones for generations to come. Remember when I asked you to recite your vision, mission, and our core values? With every decision before us, we have to ask ourselves, does this decision bring us closer or further away from that vision? And it's up to you to decide and to act together. So let's take a breath and remember why we are here. To honor those who came before us, to serve the millions who count on us, and to lay the stones for generations who will follow us. That is our opportunity, the opportunity to build our cathedral. And I couldn't be prouder than to pass this mantle to my best friend and colleague, Dr. Rich Rosato, who will lead us into the next era. Before I close, I want to thank those who made this journey possible. First, I'd like to thank Metro Denver Dental Society, my home base, and my first family in organized dentistry. Thank you to the Colorado Dental Association for your partnership and friendship over the years, where you groomed me into the leader that I am now. Thank you to my district, the Fighting 14th, where you supported me and encouraged me unconditionally to keep moving forward. Thank you to all the board members who I've had the honor to serve with over the past 6 years, and a huge thank you to my current board. It's been an honor to serve alongside you. Thank you to Dr. Betsy Shapiro and the entire team at ADA headquarters. You are the engine that keeps us moving forward. And to Dr. Rich Rosato, my friend, my colleague, and the next great leader, thank you for walking this path with me. You've brought a clear vision, steady leadership, and a heart for service that will carry this association into the next era. And I could say with full confidence that the ADA is in the best of hands. Thank you to my extended family, my siblings, my parents, and my kids. I hope I've made you proud. And to my wife, Gina, my partner in all things, thank you for your never-ending support. And thank you to the universe for the spark of grace that inspired my recovery and given me the opportunity to live my best life. Because over the years, I've learned that when you walk in an inspired path, angels appear along the way with a message. And I want to thank all of the angels that appeared in my path. Thank you. As I close, I'm going to quote Ernest Hemingway. He said he wanted to arrive at the gates of heaven, bruised and battered, having wrung every last ounce out of life. That's how I feel now. Worn, yes, but proud. Knowing I left everything out there on the field, that I gave everything I had every single day this year. There were definitely days when the weight of the hard truth felt unbearable. But then I was reminded of this Seth Godin quote, when you dance on the edge of infinity, there's always enough. Because you aren't taking opportunity away from anyone else, you're creating it. I set out to create change this year, and together I believe we did a heck of a job. So for all that I've left out on the field, I will always carry a wealth of gratitude. Gratitude for the privilege to serve this profession I love, for this community that saved my life, gratitude for my colleagues, mentors, students, family, and friends who walked this journey with me, and I don't take this for granted for a second. 27 years ago, I didn't have a dream left in me. I couldn't see beyond the next day, let alone imagine standing here as your ADA president. But through grace, I found the courage to change and the strength to begin again. From rock bottom to significance. It's been a journey of constant reinvention. Remember the architect at the Cologne Cathedral. His vision outlasted him by centuries. Remember Dr. Martin Luther King Jr., whose words continue to ring true today. Remember the 26 dentists who founded the ADA in 1859. May we never lose the courage to dream. And may we never lose the courage to act on those dreams. May we never lose the courage to keep believing that anything is possible. Because when we dream boldly and act bravely, we change lives. And we change the course of history. Today, we're building a cathedral of hope, opportunity, and optimal health that shines its light over the world. And long after the scaffolding is gone, may the soul of our work stand tall, inspiring generations to come. For me, I'll never forget the roots of my path and my moment of grace and clarity. Because in my life, in exchange for a bottle and a hangover, I've been given the keys of the kingdom. Thank you.